The National Association for Home Care and Hospice is proud to collaborate with the Council of State Home Care and Hospice Associations on an exciting advocacy event, the Public Policy Summit, on September 11th and 12th at the Mayflower Hotel in Washington, D.C. For over 30 years, the National Association for Home Care and Hospice has brought home care and hospice advocates to Washington, D.C. to speak to their members of Congress on behalf of millions of patients and providers. It is so important for members of Congress to hear from their constituents, actual patients and providers who can educate them about the benefits that only come from home health and hospice. The Public Policy Summit will help bring that message back to Washington during the heat of an election season.
We believe the most important thing is to make sure our members of Congress are well educated on the value that home health and hospice providers offer to patients in the healthcare system.
The fact that we can put a face to a name with our members of Congress, they can see us, they can tangibly associate us with the industry is so important. And I think the value proposition of home care and hospice, that we meet that triple aim of better care, better outcomes, and lower costs. And as time goes on and the cost pressures increase, we become more important. So I think it's important for us to continue to drill that message home and to continue to keep an open dialogue with our members of Congress.
Did the NAHC policy briefing prepare you to meet with your congressional representatives?
It did. There's just so much to know. So to have it synthesized in a way where, what are the top important things, that's always beneficial.
And I think the briefing we had yesterday afternoon, really helped, solidify those main points that we want to get across. It was helpful.
The NAHC policy team, I think, did a good job of communicating to us. Take all this information, synthesize it as you think it's best fit for your members of Congress, and then talk to them about it.
Our highest priority is making sure that our members of Congress understand the importance of adequacy of payment and coverage for home health and hospice benefits, and that the finer points of policy matter a great deal.
Everybody was accommodating with appointments and very friendly and very open to what we had to say. And they were asking questions. And sometimes we have to go back and do a little bit of research and get back to them. But when they ask questions, we know they're engaged with our appointment.
It's surprisingly easy and fun to do. You call, you make the appointments. As Cheryl said, they're very accommodating. They're used to constituents coming in, and so they know that you might not necessarily know all the technical ins and outs of the legislation, but that you really have a passion in your heart for your issue, in our case, home care and hospice, and you do have important stories to share.
We really just need to promote this more. I think everybody needs, the bigger and louder voice that we have from all companies in our industry, the better off we're going to be.
Will we see you back in Washington to advocate for home health and hospice?
Definitely.
Please join us on September 11th and 12th at the Public Policy Summit in Washington, D.C. Together, our efforts will ensure that the halls of Congress ring with the message that home health and hospice is the future of healthcare that the American people want and deserve. All of us in home care and hospice are grateful for the advocacy and leadership of Vicki Hoke, Tim Rogers, Jane Kelly, and William Dombey. Thank you.